your full spectrum broker. We provide everything from benefits, wellness, and HR solutions to compliance and payroll. And today we'll be going over a hot topic in telemedicine that we've seen a lot of companies implementing. And we have 1-800-MD here to help us out with that. They are our partners and telemedicine experts. We have Carol with 1-800-MD, who's going to provide a lot of really good information for you guys. Carol, if you could go ahead and go to the next slide, please.
Sure.
Just a couple important reminders for the webinar today. If everybody could please go ahead and put your phones on mute as you enter the room, that would be greatly appreciated. If you have any questions, please enter them into the chat box, and we will be answering all of the questions at the end of the presentation. And at the end of the presentation, we will be sending out a recording to everybody who attended with some valuable information. So Carol, I'm going to go ahead and turn it over to you now. Take it away.
Great, I appreciate it. Thank you very much, Marcelo, and I want to thank those from the Phase-In group for giving me the opportunity to introduce some people to telemedicine, specifically to 1-800-MD, a best-in-class standalone telemedicine company. I have a fairly brief introduction, kind of a general overview of 1-800-MD, and then some specifics on the telemedicine industry. And then, as Marcelo mentioned, I'm happy to take questions or comments at the end. And again, thank you very much for everyone for your time this afternoon. And I'll be as brief as possible, and hopefully you'll go away with a good introduction to 1-800-MD and telemedicine. 1-800-MD is one of the nation's oldest and largest telemedicine companies today. We've been around since 2004. It was born out of a personal need of our founder and CEO, Andy Jacobson, when he was on vacation with his family, and his wife became ill with a sinus infection. He did not want to go to an urgent care or emergency room to get the medication that she needed, so he called the hotel concierge and asked if there was an alternative method of care. That concierge communicated that there was a concierge doctor that would come to the hotel room and treat his wife for her non-emergency acute care issue. A light bulb went off for Andy as he talked with the physician in the hotel room. He realized not only is this affordable method and access to care, but it's convenient access to care. And never before had he experienced healthcare that was both convenient and affordable. So in 2004, American House Call Physicians was born. In 2009, we transitioned solely to telemedicine with the passage of the Affordable Care Act and became known as 1-800-MD. We still are privately held by Andy, founder and CEO. We have no venture capital money, no angel funding, and we are not publicly traded. All of our peer competitors have investor interests. And we pride ourselves in our ability to really focus on our client interests rather than our shareholders or investors, because there are none. 1-800-MD has a proprietary network of over 400 physicians in all 50 states. Our physicians are board certified in emergency medicine, family practice, intensive care medicine, internal medicine, and pediatrics. They are all board certified, and they are all credentialed and re-credentialed every 2 years and licensed out of the college that their study was in. Many of them have multiple licenses. Our consultations are available 24/7, 365, and we offer 3 types of consultations: phone, video, and email. Phone primarily is the method of choice for our members. Over 90% of consultations in the telemedicine industry in 2015 were via telephone. And it primarily, 1-800-MD experienced the same percentage. About 92% of our consultations last year were via telephone. And we do offer video and email as well. Email is informational only. We do not prescribe over email. But if you have a question on a chronic condition or a side effect of a medication, or if you're traveling and have a general question about your health, our physicians are easily accessible via email for those purposes. So as I said in the beginning, what telemedicine does is it has given us the ability to leverage technology so that for the first time, cost and convenience converge in the delivery of healthcare. So to give you a snapshot of some of the things that we treat, these are non-emergency acute care incidences. These are things like allergies, sinus infections, bronchitis, cold and flu exposure, gastroenteritis, upper respiratory infections, urinary tract infections, things like this. The AMA put out a study in 2006 where they discovered that up to 70% of office visits could have been handled over the phone. That is how telemedicine is impactful. And the success of telemedicine is about changing behavior. Rather than instinctively jumping in your car and going to urgent care or trying to get into a PCP, it's about first picking up the phone and talking to a physician. Prescriptions, if they are deemed appropriate by our physicians, are e-prescribed to the member's pharmacy of choice. So when a member requests a consultation, they tell us where they would like a prescription sent if the physician deems it appropriate. Generic drugs are automatically recommended unless brand names are necessary. Use of antibiotics are limited to appropriate durations. Our physicians are very mindful in following the CDC guidelines in order to prevent the overprescribing of antibiotics. And we do not prescribe any DEA-controlled substances, medication for psychiatric illness, or lifestyle drugs. I like to stress that we are not a prescription service. We did our own study of the number of times our physicians prescribed last year versus a typical in-office visit. A typical in-office visit will end with a prescription 68% of the time, roughly. 1-800-MD physicians prescribed 62% of the time last year. So we're actually prescribing a little less often than an in-office visit. I can't stress enough that 1-800-MD is a solution to the delivery of healthcare, a solution to the cumbersome access that we encounter nowadays. We are not another cog in that wheel slowing this down. We are taking claims out of the system. That is our goal. 92% of the time, our patient issues are resolved at the time of consultation. We have a 97% member satisfaction rate. We have over 1 million members, and last year did over 60,000 consultations. Again, those consultations are phone, video, or email, and they are available 24/7, 365. Zero malpractice claims. We have a 1-hour guaranteed response time with our phone consultation, but our company average is 14 minutes. When a member requests a phone consult with a physician, on average, in less than 14 minutes, they're speaking to a 1-800-MD doctor. Of those that have used the service, 98% would use it again. Again, I repeat, this is really, the utilization is about changing behavior. You have to measure utilization. You have to get people to change their behavior and use the service. And I'll show you some of the tools that we partner with our clients to help boost that utilization and get it started. And then a 96% overall client retention. So our clients are happy, our members are happy, and that is what we strive for. That is our sole goal. So as you may know, telemedicine companies are governed by the individual Board of Medicines in each of the 50 states. As you can see on the screen, the majority of states in the green where telemedicine is fully functional. They've been very proactive in getting telemedicine available to their constituencies. We have one state where no telemedicine is available at the moment, and that is Arkansas. The Arkansas Board of Medicine still requires an in-person office visit for the delivery of healthcare. We expect that might change in the spring of 2017, but our compliance people are watching that. California and Georgia are yellow, and what that means is it's short-term prescription limits. I happen to live in Georgia, so I have firsthand experience with this. Instead of a 14-day supply of amoxicillin, I'll get a 5 to 7 day supply of a different type of antibiotic. The efficacy is the same. The issue is still resolved. It's just I don't get that 14-day supply. And then the orange states are phone consultations only. They do not allow video, which is not really impactful to telemedicine because over 90% of consultations are telephone anyways. And then Idaho is video only. So we are also watching Idaho and expecting Idaho to also change to be fully functional in 2017. I get the question often, are you more applicable or more successful based on industry or sector or socioeconomic status, white collar, blue collar? The answer is no. We have successful client programs across all sectors of industry, from manufacturing and trucking, organized labor, hospitals and universities, financial services and banking, healthcare, and additionally, the myriad of small businesses that we work with throughout the country. We took a look at 2 clients to dive a little deeper into the subject that have been with us since inception. So client A is a lumber company, and client B is an insurance company. They have similar pictures as far as covered lives and activated members and annual consultations. And the lumber company in 2015 had a year-to-date savings of almost $25,000 in claim savings. Client B, the insurance company, was close to $40,000. Part of what helps our clients be successful is 1-800-MD's competitive edge. What we do really, really well. The strength of our integration. We're a fully integrated company, everything from our call center to our IT teams, marketing teams, client service teams, member services teams. Everything is in-house in our corporate offices. We are a best-in-class standalone product. We are not tied to a carrier. What that means is if the carrier is disrupted, this benefit is not affected. It also means that we can provide the benefit to those employees that may not be on the health plan. They might be part-time or 1099 or non-benefited. Again, our 3 types of consultations: phone, video, and email. And then the tools that we've developed to drive utilization. Our plan is designed to engage clients and members, and we've got established and proven marketing strategies to do that. So as Marcelo mentioned, telemedicine has become kind of a buzzword. Several years ago, I talked to someone about telemedicine. They weren't quite sure what it was, why it would be important to them, and how it impacted them. JAMA did a study last fall in October, and they found that the average total visit time for an acute care incident was 123 minutes. And that included the drive time to the clinic or office, the waiting room time, as well as the face-to-face time. And what that meant in hours and dollars is 1.1 billion hours of time and $25 billion. The advantage for our clients is that in this day and age, with rising healthcare premiums, the cost of care is skyrocketing. This is an affordable benefit add. We have flexible plan options that are not tied to a carrier. We offer 4 standard consultation fee options, our most expensive being $38, and we offer a $20, a $10, and a $0. Over 90% of our business is $0 consultation fees, meaning when a member requests a consultation and speaks to one of our physicians, they pay nothing. And dependents are included in our pricing. And because Phase-In Group is a ProCentral partner agency, they have aggregated pricing that is very, very aggressive. And it is truly an affordable benefit that's impactful to members. In every proposal that we provide Phase-In, we take a look at a couple of things. We take a look at expected savings as well as a break-even point. At the break-even point, what we try and show the client is based on the PEPM access fees and the number of employees, we take a look at how many consultations 1-800-MD has to have in order for the client to experience a break-even point with claim savings. I'll explain it a little bit further here with the expected savings sheet. This is an example of a client that has 250 employees, and they're paying $3.48 per employee per month, and that includes their dependents. So their total number, including dependents, is 460. I take that 460 number and I multiply it by the national average of incidence rate of 1.8, meaning that on average, we will see a physician for a non-emergency acute care incident 1.8 times per year. Some of us go 0 times, others of us go 5 or 6 times. The national average happens to come out at about 1.8. So I take that total member number, 460, which is employees plus dependents, I multiply that by 1.8, and we get a total pool of incidences that we can pull from 828. Our average first-year utilization is 17.5%. That's across all of our book of business, all of our clients. The average is 17.5%. If this client performs as expected, as our average client expects, 1-800-MD will handle 104 of those incidents, leading to a claim savings based on national averages of a little over $14,000. In year 2, our average utilization rate climbs to about 20%, and in year 3, about 25%. We have many clients that outperform these averages, and we have some clients who underperform. And that's where we have a real opportunity to partner with that client to boost that utilization. Many of our clients outperform this. I've had utilization reports and rates showing utilization in excess of 50% for many of our clients. It can lead to some impactful and substantial claim savings. The other thing that 1-800-MD does very well is our integration process. We know everyone is busy. These HR teams are very, very busy. We don't want to pile another list of to-dos on their already long list. We try and make implementation as simple as possible. We ask for a 2-week implementation time. That gives our team to do the initial enrollment. Takes them a couple of days to get everyone loaded into our system. And then we order fulfillment with a fulfillment vendor. And what we provide with fulfillment is a welcome letter and ID cards mailed directly to member homes. Now we will also provide that digitally if the client desires e-fulfillment. Then we require email addresses and we'll deliver that communication electronically. Every client has a dedicated client service team. Again, our member services teams are in-house as well. Our members gain access to our user-friendly member portal where they can load their dependents, fill out their health histories, they can request consultations, and we have some other helpful tools on that site as well. And then, in the end, we measure the program's success. That's what a lot of people are looking for. And we provide that quarterly. So quarterly reporting shows you month over month how your utilization picture looks. And I have some images of that here in just a few minutes. So with fulfillment, we have the traditional open enrollment materials, posters, brochures, refrigerator magnets, postcards, etc. We will mail those welcome letter and ID cards directly to the member homes, or we will deliver them electronically. And then, as I alluded to earlier, some of the tools that we have as far as communicating and changing behavior, we have digital monthly member awareness communication pieces. They go out monthly. They'll either go directly to the members or they'll go to the HR team, and the HR team will determine how they want to disseminate the information. But it's just a reminder that the service is there, how to contact us, that we can co-brand any of this digital material with the client logo to further drive home that point. This is a benefit being provided by the employer. All of our digital content has a QR code so that members can download our smartphone app and access the service directly from their smartphone. This is an image of our member portal homepage where you can see the member can click a link to add their dependents. They can request a consultation. Then, of course, we have some other helpful items on here, drug interaction checker, symptom checker, pregnancy information, things like that. Our health history form is a double-page click-through, very easy to fill out. We ask that the health history is filled out before a consultation happens, so that our physicians have a chance to review that health history before speaking with the member. However, if that member has not filled out that health history, it does not preclude them from using the service. Our physicians will still take the consultation and fill the health history out over the phone, and then encourage that member to go back in and update that health history. Our physicians also load onto the member's portal a consultation record, as well as a copy of any prescription that was issued, so that the member has the ability to download that consultation record, to pass it along to a specialist or PCP, or if they need to provide a work or school note. And then the quarterly reporting. Again, we provide it quarterly. It's a multi-page report. The first page, which is the image on the screen now, is the complete picture. What you're paying in access fees, what your members are paying in consultation fees, month over month here on the bottom, how many covered lives, how many total member lives, meaning including dependents, and how many lives have activated. Activated means they filled out that history. At that point, that member is considered activated. And then we watch month over month and track how many consultations are happening. When a member requests a consultation, they are asked, where would you have sought care if you did not have 1-800-MD? And we capture that information so we can then in turn tell a client, instead of 10 visits to the emergency room and 25 visits to the PCP, you had 35 telemedicine visits, and that's how we extrapolate claim savings. We use national averages for the emergency room, urgent care, primary, and retail clinic, but if you have client data that you can submit to us, we can find out what your actual costs are and refine this reporting even to a finer degree. We then break additional information down. We can tell you what your top 10 prescriptions were, what your top diagnoses rates were, what the ever-important return on your investment is, extrapolated claim savings versus what your access fees, what the benefits costing you, and then gross cost versus total savings. Again, this reporting comes out quarterly. The key to successful telemedicine is utilization, and the key to utilization is breaking and changing behavior and using the member awareness tools that we have and the open enrollment and the traditional fulfillment materials we have are a big step in making sure the program is successful. What we have noticed is the stronger the partnership we have with our clients, the more successful the program is, as well as the positioning that the HR team takes. HR teams are so powerful in the communication of benefits, and those that really take 1-800-MD and run with it, co-branding those digital materials, developing an annual communication strategy, they have success greater than our averages and on a much faster pace. And so to summarize why 1-800-MD is your telemedicine solution, a few of our differentiators: the strength of our integration, our integrated client service, member service teams, our IT department and marketing teams, our ability to, rather than provide you with a product that you have to fit into your benefit package, you tell us how you want the product to look and we can design it so that it's a seamless integration with your existing benefit packages. Every client has that dedicated team for member awareness, client relations, and member services. You have contacts for those people that you can call. There's phone trees. You're not going to get transferred from one desk to another desk. You have a dedicated person in each of those teams to contact for questions. A simple implementation process, that 2-week time frame. Our census can be given to us on a simple Excel sheet that we can provide you with, or we can take file uploads, FTP file uploads. And then, of course, our best-in-class post-sale utilization reporting, measuring that success, taking a look at what your utilization picture is, if there's opportunities to do things better, or if there's reasons to celebrate success, great successes. We enjoy that quarterly reporting, and we know that it's an impactful tool for our agents to share with their clients. So Marcelo, that is kind of the end of my general introduction to 1-800-MD. Again, I appreciate everyone's time this afternoon, and I appreciate Marcelo coordinating this, and the phase-in group for allowing me the opportunity. I know that there may be a couple of questions, Marcelo, so I was going to hand it back to you and see what the reaction is.
Yeah, definitely. Thank you for presenting that. We did have a couple questions come in. So the first one was if you could please repeat the types of physicians in your network.
Sure. So our physicians are board certified in either emergency medicine, family medicine, intensive care medicine, internal medicine, and pediatrics. We do have a few OBGYNs on staff as well. In fact, our medical director happens to be an OBGYN.
All right. And can this be offered to employees of a company on a voluntary level?
So we do not offer a voluntary plan. Our minimum is all those that are enrolled on the health plan are enrolled in 1-800-MD. So that's the short answer to that. Previous years we had offered voluntary programs and just struggled. We found that clients struggled with success levels, so we decided to go all in with employer paid and really ramp up our partnership abilities with communication strategies and member awareness pieces, etc.
Okay. And do you cover mental health?
So that's a great question. Behavioral health, we're looking at bringing it on at 1/1. We're not going to roll it out nationwide. We are still evaluating kind of the efficacy of it, but it is something that we have providers for. We've not made the announcement yet, but per request, if a client would like behavioral health, yes, we will add that to the platform.
Okay, awesome. And lastly, what is the cost for the service and what's included in those costs?
So I'll just give you an example. The $0 consult fee is typically around $350 per employee per month. And what that includes, of course, is access to the service, including the dependents of the employees. And then it includes all of our member awareness communication pieces, development of a communication strategy, the welcome kit, the welcome letter and ID cards, all the open enrollment materials that you require, and the quarterly reporting.
All right. And if somebody wants to get a quote after seeing this presentation, what should they do?
So contact your Phase-In contact, and then Phase-In will provide me the request for proposal. I think is the best way to do that, Marcelo.
All right. We had a couple more questions come in just now. Will behavioral health piece be an additional per employee per month fee once it's rolled out?
Once it's rolled out, we anticipate that the answer to that question is no. That it's not going to be an additional fee.
All right. And someone asked if you said $350 per person per month. I believe that's $3.50, correct?
Correct. Thank you for making that correction. $3.50 per month. And that's for our $0 consult fee plan. So that's our most expensive consult fee plan. The $38 consult fee plan, I think, can be as low as about $1.95 per employee per month. But I do stress to clients that the $0 consult fee, they have a greater utilization rate and a faster ramp-up rate. That average first-year utilization rate of 17.5% is based on our $0 business because it's the bulk of our business. Our $38 consult fee business starts at about 7% for the first year and tops out at about 13%. So it's quite a big difference as far as utilization. Once you remove that barrier to entry, once a member knows they're not paying anything out of pocket to talk to a doctor, they're much more apt to use it. And once they do use it, 98% of the time they use it again.
Okay, great. That is all the questions we had. I just wanted to remind everybody that they will be receiving a follow-up email from Phase-In Group. We're going to provide you with some of the information you've seen today, along with a recording of the webinar. So I just wanted to thank everybody for attending, and thank you again, Carol, for doing such a great job.
Thank you, Marcelo, and thanks all for attending and your time today.
Thank you. Have a great day, everybody.
Thank you.